So do you ever foresee a world where hearing aids are ever exclusively rechargeable, or do you think will always be batteries? Okay.
Honestly, I really think that we're pretty close. At least in our office, we're seeing, I'd probably say 80% of our hearing aids, if not more, are rechargeable.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
We are one day removed from Father's Day, but Ask an Audiologist is the gift that keeps on giving. Though I am not a father, I am your host, Kevin Ziener.
I'm Dr. Jordan.
In this ever-changing world of technology where companies are making leaps and bounds year after year, it is fair to say that most patients have no clue what hearing aids are correct for them. But Dr. Carol Hawkins of Hawkins Hearing Center in Salon, Ohio, has written an article that we will discuss today about determining whether or not rechargeable hearing aids are right for you. So, Dr. Jordan, acknowledging that we only have like 10 minutes, can you tell us about all the types of hearing aids that exist, and then we'll get into whether or not rechargeables are right for certain individuals?
Sure. Yeah. So there's so many different shapes and styles and colors of hearing aids that are out there, including batteries. Yeah. So you've got rechargeable batteries, and you also have zinc-air batteries, which are like disposable batteries. So with rechargeable hearing aids, they can all look the same versus if they're zinc-air disposable versus if they're rechargeable.
Got it.
So other than the very, very small hearing aids that go way down into the ear canal, they don't, as of today, they don't have those in rechargeable yet.
So the little baby ones that are like meant to be invisible.
Right. Invisible in the canal.
Do some of them have like a little transparent antenna?
Yes.
That pop out? Yeah. Looks something like the Jetsons.
Sometimes it's like a little pull cord, just to be able to pull it out of your ear. Yeah.
So those are the only specific hearing aid devices that have yet to be rechargeable.
Right.
It's probably because they're way too small.
Right. It's just too small.
Okay.
And it also depends on the size of your ear canal if the manufacturer can make a hearing aid small enough to fit the rechargeable battery in it.
Got it.
So a little bit of a caveat there, but they, by definition, they do have rechargeable hearing aids that are just like an in the ear type of hearing aid, one that doesn't go over the ear.
Got it.
But they, of course, have them over the ear that are rechargeable.
Sure. Got it. Fair enough.
Yeah.
But so then the majority of the other types of hearing aids, they all come at least with some option of a rechargeable based on what manufacturer you're working
Correct.
with. Okay.
Yeah.
So we had spent a podcast a few months ago talking about the reason why people would still use batteries. And of course, I had said then it makes sense to me to only ever want something that's rechargeable. Like if I have to manually remove stuff from my listening device, I'm going to go crazy because I am an entitled millennial and I want everything to just work seamlessly right out of the box, and I never want to touch it again.
That's right.
So what would be like, what lifestyle, what profession, what surrounding environments would be proper for somebody to be fitted with a rechargeable?
Sure. So patients who have issues with dexterity, they don't have to find those little batteries and fiddle with them. That's a big one. Yeah. Especially in our field, we see a lot of geriatric patients with that problem. So that's a big one. Profession-wise, if you have a job where, you're going to be working for long periods of time, meaning typical rechargeable batteries are going to last you around 14 hours on a single charge.
Got it.
So you're going to need time to charge those hearing aids back up.
How long does that usually take to recharge?
Well, it takes about 3 to 4 hours on most.
But that's a good time. It's not like hey, I've worn these for 14 hours. I have something I need to go to. I'll do a quick charge on this. It's like, oh no, you got to set aside some real time.
You can do a quick charge. Most hearing aids, if you put them on charger for like 30 minutes, you're going to get like 5 more hours of use out of them.
Good.
So, I mean, even if you do have a job like that, if you do have a moment where you can put them on the charger for a little bit, go for it.
Got it.
Because also in those types of professions, you may not want to have to carry batteries with you all the time either.
Makes sense.
So you got to find what works best for you. Do you want to have to hunt your batteries, or do you want to have your charger with you and you've got to put them on the charger?
Got it. Do some rechargeable hearing aids come with charging cases? Like, how my biggest frame of reference is AirPods.
Yeah.
You can charge the AirPods through the case, which can also be charged. Is that a similar piece of technology?
Yeah, not all hearing aid manufacturers have it yet, but most of them do.
Got it.
Yeah.
So if you do find yourself knowing that you're going to be away from the house for a very long time,
right,
depending on what manufacturer you have, your charging case can be portable too.
Right.
Awesome.
Yeah, and I also have some patients that'll just buy a second charger. Like if you know that you're going to be at work for long periods of time, they'll just buy a charger that'll stay at work.
Smart. That makes sense.
It just depends. If you want to be able to haul it back and forth and it's got like a power pack built into it,
got it.
Then you can bring it back and forth with you if you want to do that.
So when you are you've obviously diagnosed a patient, you understand that there's a certain level of hearing loss. What factors are you looking at specifically as to whether or not a battery unit is going to be okay or a rechargeable unit? What is like the top 3 things you look at and you're like, okay, based on this, I know that they probably need a rechargeable.
Yeah. So it's going to be lifestyle. That's a big one. How, for like a kid, that's a little bit different, versus an adult. So for kids, we need to make sure that battery is going to last long enough. So if we know that they're going to be using this all day long, sometimes we may go toward traditional disposable batteries versus rechargeable, because we know that in a pinch, you can take that battery out, put a new one in. For an adult, like I said, if they have dexterity problems, then we may lean more towards rechargeable.
Got it.
But sometimes we've also got to kind of take into account the dexterity of the charger. Some chargers are easier to put the hearing aids in and take them out than others. So if dexterity is a problem, we're also in the back of our minds thinking, what charger do we need to make sure that we go with or avoid?
Got it.
Yeah.
So do you ever foresee a world where hearing aids are ever exclusively rechargeable, or do you think will always be
close.
Batteries?
Honestly, I really think that we're pretty close. At least in our office, we're seeing, I'd probably say 80% of our hearing aids, if not more, are rechargeable.
Interesting.
Yeah.
Because this is kind of a similar conversation about, do you buy a gas powered car or do you buy an electric powered car? Like, what are the like an estimate? Like, what I wonder what the overall savings of having to go buy batteries all the time as opposed to just recharge. Yeah. I mean, like if you had to guess, just we're not going to hold you to this, but what would you guess? Tough. Like, what does a normal battery pack cost?
Yeah. So a battery pack normally they're typically like $1 a battery. Okay. So there's normally 6 in a pack. You're looking at $6, $7.
And as we've talked about on previous episodes, they might last you for 3 days or they might last you for a week, depending on the size of the battery. Right. So really one battery pack theoretically should get you at least 2/3 of the way through a month, if not an entire month. So I guess it's like $72 a month on the low end.
Do the math, Kev.
Maybe $120 annually on the high end. So yeah, $72 a year on the low end, about $120, $130 on the high end.
But that's per hearing aid.
So now we're at like $150 and we're at $260. So over the course of like a 3-year, 4-year warranty, we're looking at almost $1,000 in batteries for 4 years.
Yeah. I mean, and it depends on the clinic that you go to. If there's a different price for disposable batteries versus if there's one for rechargeable, that's definitely something you need to talk to your audiologist about. Yeah. So, I mean, that can sometimes drive the choice for the patient of which one they go with.
I also want to point out that I did math in my head, and Dr. Jordan in no way gave me a compliment for doing it, but she was right to not give me a compliment because she has no idea if I was actually correct with my math.
I was not going to fact check that.
No,
whatsoever.
And you shouldn't.
Somebody fact check that.
Yeah, depending on where you live in the United States, someone's going to be like, no, it cost me like $1 to buy all these packs of batteries. They're like, I don't care. So it's like, it cost me $20. This is the worst podcast ever. They don't even know math. Well, the one host doesn't even know math.
I definitely am not going to sit here and try to do math in my head.
We're going to do math after this, and if we're wrong, we're cutting that entire part out.
Absolutely.
That's a producer thing. Any last notes about rechargeable hearing aids?
No. I mean, I think it's just a matter of talking with your audiologist and finding what's going to work best for you.
Got it.
Yeah.
And now with all of that information, both useful and clearly useless, you are a little more prepared for when you meet your audiologist. But if you need more info, please go to askanaudiologist.com to do all the research you need to be equipped. You earned your keep today, Dr. Jordan. Great job.
You too, Kev.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
The better ear is the anchor for what is happening on the other side of your head.
Because that's the only usable hearing that we have.
Got it.
Right. So what a bone anchored or an osseointegrated device allows you to do is hear on the side.
Got it.
So if we're sitting at a table and somebody is sitting on my poorer side, my poorer ear, then I don't have to crane all the way around in order for them to talk into my better ear.